Hello, everyone. I'm Dr. Hockman. I'm the medical matchmaker, and I have Dr. Aguirre here today. So, just as a quick introduction, I help doctors find practices where you can really enjoy practicing medicine again. And I'm so excited to have Dr. Aguirre here for many reasons. One is I just watched her TED talk today for the third time because I enjoyed it so much. And any physician who watches it, you're going to absolutely see yourself in some or all of it. So just in a second, I'm going to have Dr. Aguirre introduce herself. If you're watching, please type hashtag me first. If you watched her TED talk, you know why. So yes, whether this is live or a replay, type hashtag me first. And I'm going to have Dr. Aguirre introduce herself a little bit.
All right. Well, thank you so much for having me on. I am just so appreciative. And actually, it's been kind of a whirlwind week. And yeah, for those of you who don't know me, my name is Liz Aguirre, and I practiced as a hospitalist for 10 years. And as my story unfolded on the TED Talk, you know that I've gone through burnout 3 times. And after the third time, I got really scared because I thought, man, if I'm getting burnt out in this role where it really is so much easier than my past roles, and I'm not on overnight call anymore, and I'm not working 24, 36-hour shifts, and I'm not on pager call at night. Like, if I'm getting burnt out on this, then what am I going to do? How am I going to continue my career? And this is when I really had some deep soul searching and some deep healing. And through that process, I really discovered how many people were hurting just like I was. And at the time, when I was in the middle of that chaos, I couldn't see it. I thought I was all alone. I thought nobody understood. I thought I was literally at the bottom of the mountain and everybody else was standing in the top. And yeah, I just kind of unraveled from there. And I started speaking for conferences and speaking within my organization. And I found myself just called to do this because I really wanted others to see that it is possible to have successful careers without all the burnout and overwhelm. And I did not believe that for so long. I kept thinking, I have to find another job. I have to leave this job, or I can't practice in this career anymore. I almost retired my medical license for good. And it was all fear-based. It was all fear-based. And that was something that I really discovered through a lot of soul searching and a lot of coaching. So yeah, that's kind of how it came to be and how I ended up on a TED stage.
And so you speak for organizations, right?
Yes. Yes.
So tell me a little bit, do you speak to them about burnout or about, what is it that you typically speak about?
Right. I usually speak about self-care as a means to optimize your professional success and prevent burnout. So a lot of people right now are talking about burnout, but there's this whole piece before you actually get burnt out that you really want to become a really strong and vibrant version of yourself, because this is when you really have the ultimate success. Whenever you achieve your goals and you can actually enjoy it instead of being stressed and overwhelmed, that is really the golden ticket there in my mind. And so when I speak for organizations, it depends on what they're looking for. Sometimes I speak about burnout if there's a lack of engagement or they can see the morale is down within the organization, or if I'm speaking for a conference and they know that the audience is really struggling, I absolutely speak about burnout. And before that, the steps before that or the steps after that, I'm talking about, why we make those decisions and the fear that leads us down that path, and how to be making conscious decisions so that we're having, the best chance at setting ourselves up for success.
Yeah, I'm going to come back to that in a little bit. I want to talk about that fear. And we had a question actually that someone posted. I'm going to read it to you.
Okay.
And I think it will at some point. I would love for you to talk about your upbringing, because that's a big part of why you inspire me so much. But before we do that, I'm going to read you this question. It says,
Okay.
"Good day to both. Would love to hear your input on how you would deal with a reactivation of a previous traumatic experience, a prescription error that was rectified near miss but still haunts me." I think
Mm-hmm.
we've all been there as physicians, that fear of making a mistake, the fear of hurting someone, the fear of doing what you know is best, and someone's gonna, give you a bad Yelp review because,
Right.
because
Yeah.
even though it was the right thing, it's not what they wanted. So, but yeah, this is a big
Absolutely.
one, the previous traumatic experience that just never really goes
Yeah.
away.
Well, first I'll say you are absolutely not alone. If you've practiced in medicine for any amount of time, you know that mistakes are going to happen and we are not perfect. We are human beings. We are not robots. And so to expect 100% perfection at all times, it's just not part of being human. So we know it's going to happen. But I still remember the first time this happened to me. I had a patient come in with acute kidney injury and I didn't hold the lisinopril. So for those of you who are non-medical, it's a medication that we absolutely should hold if they come in with kidney injury. And, nothing happened to the kidney function. It didn't get worse or anything because, of course, the patient was taking the medicine at home. But I remember talking to my director about it, and he's like, "Oh, Liz, you just haven't been practicing medicine long enough. It's going to happen." And to me, that was like the most horrifying thing that could have been said at the time, because it was just saying like, "Oh, it's okay. It's okay. Don't worry about it. And it's not a big deal." But it was a big deal to me. So first I want to acknowledge that it is hard when we make mistakes or we do things that are not 100% perfect. It really does haunt us. But we have to be forgiving of ourselves and realize that we're human, number one. And number two, sometimes in my talk, if you haven't listened to it, I encourage you to do so, because one of the first things that I talk about is vulnerability and being willing to ask for help. I have learned a great deal through personal coaching. I was introduced to the coaching world 2 years ago, and it has been life changing to me. And I talk to anybody who will listen about coaching, and I am not a coach. So I feel excited to talk about it because coaches are like, yeah, they think I'm trying to, recruit them as a client. And for me, I'm like, no, I'm not selling coaching. I'm not a coach, but I can tell you it works because somebody sees things more objectively than you can see yourself. So if you're constantly having that reactivation, I'd say ask for help. That can be a counselor, that can be a therapist, that could be a coach, that could be a physician. It can be any number of different avenues of support. There's even groups for the physician community in terms of lawsuits and problems of that nature. So I'd say ask for help and realize that you're not alone and none of us are perfect. So that's a really great question, though, because that fear that this person is feeling is driving their decisions. I already know it just from the question. And whether it's she or he is being overcautious and triple checking themselves and working, 2 extra hours because they're constantly having to recheck, or running things by their colleagues all the time when they know the answer. There's probably some other stuff going on there as a result of that fear. So I'd say really face that fear head on and just like work through it with someone who can help you see things a little differently.
Yeah, thank you. I think it's so hard for us to, as physicians, to accept that we've made a mistake because the stakes are so high.
Yeah.
They're so high. And
Yeah.
and we're perfect, right? We're not humans, we're
Right.
perfect.
Yeah. We're
So
pretty close to machines. Exactly. And,
exactly.
here's the other thing too, I was thinking about. There's not a one size fits all, right? Coaching has been really valuable to me. And some people are like, there's no way. I don't like coaching and I feel like I'm being judged. Maybe coaching isn't for you, but I do find it challenging to think that we need to go at it alone. Whether it's a very personal friend that's a confidant, or a spouse, or and any other networks, there's not one right way. We're all different human beings. We all react different to trauma and to different experiences. So, sometimes it takes exploring different avenues to really figure out what it is that's going to help you.
Yeah, and something you and I were talking about. Now, you speak in your TED Talk about vulnerability, so I believe it's okay for me to talk to you about this in this public forum. But your fear, and actually you did talk little about that in your TED Talk of, I'm going to pause there. Tell us about your upbringing, and I mean, and I'll just kind of preface this by saying I remember the moment I heard you speak for the first time. It was on the Dare to Dream podcast, probably exactly a year ago. And I remember clearly what I was doing, where I was, because I was so blown away by you. And
Wow.
so, me reaching out to you to say, hey, come chat is not just from watching this one TED Talk. I've heard you speak, and I'm blown away. So tell us a little
Wow.
bit about
That,
about
I
your
mean,
upbringing.
that blows me away. I mean, really, the decision to talk about my childhood and incorporate that into my talk was extremely challenging. And I I don't know if you can hear it in my voice in the talk, because I have no problem standing on stage and talking. I get in my zone and I connect and I see faces and I see light bulbs coming on. And so I'm no longer thinking about me when I'm on stage. But to hear me back in a podcast or a video or something is extremely challenging for me. So I don't know how it sounds on the recording, but for me it was still, even though I wrote out my thoughts and what I was going to talk about, and I obviously had worked through that and come to a place where I was comfortable sharing, it was still so, I mean, just emotional for me. I was extremely emotional when I gave that talk. And I was quite surprised at how many people came to me afterward and said, you know what? I was homeless too. Or, you know what? I used to dig in dumpsters too. And so, I think for me, my childhood, there was a lot of embarrassment, a lot of fear that people would find out who I really was, and that we didn't have electricity or light. I remember like having a little lantern and turning the flame up really bright so that people would think we have electricity. And my parents coming back in, "What are you doing? You're wasting kerosene. You need to turn that down. It's just enough for you to be able to see." And just little things like that stuck with me throughout my challenging childhood. But one thing that I was so blessed and I always felt was love. I always felt love from my parents. I always felt supported. And, one of the things that recently came out in my coaching was when I started to get more scared, more insecure, and start to withdraw and take backward steps in my professional journey. And it was after my father died, my fourth year of medical school. And the reason was, all through my upbringing, my dad led me to believe that I was like the most amazing person ever. And everybody is going to find out how great you are. And you are so brilliant. And you think your mind is so great. And look at how well you do this. And he was always feeding that into my mind. And if I came home and said, somebody said this or someone did this, like, he would squash it before my brain really had the opportunity to go on that downward spiral. My dad's like, "Oh, that's crazy. Look at all these other things you've done, or look at this, or how about that test?" Like, he really did that for me. And, my mom, a lot of people don't know this, but I have a brother with cerebral palsy. He doesn't walk or talk. He has a peg tube. And my mom has taken care of him her whole life. And the one thing I can say is, like, I remember some specifically challenging points, like, the breakup of a boyfriend. And I remember like crying in a pillow, and my mom just had this gentle nature about her. She would just come in quietly and she would just rub me or touch me. And it was those little things that my parents did that were huge things. And that is what gave me the strength to keep going. That was the thing that made me believe in what was possible. And so when my dad died after my 4th year of medical school, it was kind of like a downward spiral. I didn't have that person there anymore. So that's why I say, whether it's a network, it's a coach, it's a spouse, it's a parent, we need someone. We need someone to support us in our journey when our mind starts offering us thoughts that are just not true. And so when I lost my dad, that's when things started. Now I can see that retrospectively started going down. And then when I met my husband, you've met my husband, he's amazing. He became that person that was helping me believe in what I was possible all over again. Except I had a lot of backtracking. So it took a lot of years of kind of reinforcement. And now, like, if you've listened to my podcast, like, it is very common for me to have sticky notes that say stuff like this. Like, I remind myself, and I am around people who are going to reinforce that. And, inevitably, we're going to be around people who don't think we're awesome or think something we say doesn't make sense or that doesn't apply to them. And it's going to challenge our own beliefs about it. And it's, but my childhood, as challenging as it was, I mean, there are just things that, and I think that TED Talk says it all. I mean, we didn't have a place to live for a while and we lived in a tent. And actually, that's another little known fact that people don't know. This is actually my second TED Talk. My first TED Talk was a virtual one, and I didn't promote it at all. What if people didn't like what I said? What if they didn't like, what if they come out and start saying negative stuff about me? And the funny thing is, that talk was about using our imagination for a positive, like, frame of mind and not falling into that what if scenario. And right after that talk, I went right back to hiding. And
Dr.
so
Aguirre.
I know. It's crazy. So this one, like, even between that first talk and the second talk, I've continued. It's a continued practice. We're always going to have those things that come back to us, and things that we remember suddenly that we had blocked out of our minds. Like, that is happening to me a lot now. And I'm like, ooh, I forgot that happened. And ooh, that was hard. But those challenges of my childhood, like, walking to school in the rain. And, I was just telling my kids, we're in Texas. We had this ice storm. And when I was young, you had to watch TV and look at the bottom of the screen to see what's scrolling across in terms of which schools were canceled. Well, I didn't have electricity. And so we didn't have a TV. So we would have to get dressed and start walking to school and see if we'd see anybody else. And if we didn't see anybody else, it must be canceled, and turn around and walk back. And so, yeah, just, little things like that. Like, I would have never remembered that. I haven't thought about that in years. And then this ice storm happened, and there's another memory. Okay.
Gosh,
So,
I was
yeah.
thinking about you after I had listened to your TED Talk today for the third time.
Yeah.
And talking, when you talk about your childhood, there's definitely a lot of emotion in your voice, but there's also a lot of, and for those of you who didn't pick up on this yet, Dr. Aguirre grew up in extreme poverty. So when you talk about it, there's definitely a nostalgia about it. And so here we are in the snowstorm. I have had no electricity for a few days. We're freezing cold. And I put a lot of work into trying to make sure it's fun for my kids. So, let's go shovel ice, or let's, making it fun, or all these silly things, like, instead of like, oh, I have to do this thing now. Like, okay, let's go boil water so that we can, whatever. And
Right.
I was thinking about you talking about getting your food from the dumpster and how it was like such a great day because, you got to eat better food on those days. And I was just thinking, your parents are incredible that they made it so that you felt like this isn't bad. This is great. Like, I get to go have some food today. And so, I feel like as a parent who's going through, I mean, not even close to the extreme, but like trying to make this like fun for the kids. And hey, isn't this great? We get to all have a sleepover. We get to snuggle with the
Yep.
dogs on the couch, like making that fun. And your parents like really must have been
Yeah.
phenomenal to give you that nostalgia as an adult. When you talk about in your first TED talk where you talked about the imagination, you talk about it so great. Like, I went to go play in the trees because I had nowhere else to
Yeah.
play. And
Yeah. And, as kids too, like, children are so resilient. And as parents, we're often, trying to protect them because we don't want them to have any hurt, any struggle, any sadness, and of course, as a parent, we want that. But the reality is they're going to experience it. So when they are experiencing it, help them to see it in, not just a negative way, but a positive spin. And to be honest with you, I don't know that my parents did that for me. I don't know that that came from my parents so much as it came from as a kid when you're literally starving, like literally you haven't eaten in days and you get food. It is like the most amazing thing ever. Let me tell you, it is amazing. And so, that part, I don't know that they gave that. It came from me as a child. And as children, we see things very differently. And yeah, my first TED talk, I talk about, we lived in a tent and we would go explore nature and we were climbing up trees and we were trying to, throw rocks at squirrels. It was just something that as children we did. And we lose that as adults. When we become adults, it all becomes very serious. And I remember my husband telling me, like, babe, life isn't so serious. And I'm like, oh, what do you mean it's not so serious? I'm a doctor and I have a lot of responsibility and you don't understand. I can't tell you how many times I've said, you don't understand, you don't get it, you don't know. And we all say those things. But if we stop and listen and we really hear what people are trying to share with us, they're trying to help us. They're trying to help us, but we're resisting it because we're so deep in the misery that it's hard for us to even begin to open the door to believing those things.
Yeah, very true. We had a couple of comments here. So Dr. Layton says, speaking of asking for help, there's a book and Apple TV movie called The Boy, the Mole, the Fox, and the Horse, which is a beautiful story that resonated a lot with me. And I'm just looking for a book to read. So thanks, Dr. Layton.
That is awesome. Okay, you're going to have to remind me the name of that. And
I'll send it to you. Yeah.
I kind of feel like I've heard that more than once. I think that the book has been brought up before. So I have to take
I'm going to go check it out
listen to
today.
that too.
And then we had a question from Dr. Stewart. He says, what would you say are the risk factors, like the top 3 for burnout for newly graduated residents in medicine today? How do we prepare or protect against this? I'm going to keep my opinions to myself, and I'd like to hear what you say.
Do you know when you read that question to me, like I literally got chills, like my whole body got chilled because I remember getting out of residency and going into my first job and thinking, this is crazy, but I better not say anything because then they're going to think that they made a mistake by hiring me. And by crazy, it was, we were working 24 hours and then we had to stay and round on our patients the next day. And we were admitting and seeing patients. And so it really was crazy. And now, like after the fact, after I had been in that job a few years, I was like, I finally had the courage to start talking out about it because I was like, I'm not going to make this. And then I realized, I wasn't crazy. It really is unrealistic. But in answer to your question, I think one of the number one risk factors is being too afraid to show vulnerability and admit when it is not safe for you. I had a friend during residency and she was in a surgical residency. And I was telling her, like, I was having such a hard time with sleep. And she's like, girl, let me tell you, I have figured it out. On your way home, put your hair in the door so that if you start to fall asleep, it'll catch your head and it'll jerk you awake. And I'm like, oh my gosh, that was a brilliant idea. That's horrible advice. But both of us at the time thought it was the most amazing idea ever. So being vulnerable is so important, and not being vulnerable is one of your biggest risks of burnout, because you think I should be able to do this. And let me tell you, if your body is telling you this is not physically possible and you're falling asleep standing up like I have and many other people have, then, we need to listen to our bodies, and we need to be okay saying, this is not okay and I can't do this. I can't is one of the hardest things to say. We're always taught, never say I can't. You can do anything you put your mind to. When your mind is working. If you've been awake for 72 hours, it doesn't work so well. So number one is not being vulnerable and not, admitting when, it has reached the point where it is just not safe for you as a human being. So that is number one risk. Number two is this perfection thing. I think we all think that we should know it all, do it all, have it all figured out. And that's just not realistic. When I got out of residency, I would never consult, because I was like, well, I technically know how to manage this. I should be able to do this. And my director said, look, it's not that you can't do it, it's you don't have time. You can't manage 28 acute hospital patients and expect to get done. So have the nephrologist manage the acute kidney injury, have the cardiologist help with the MI. So again, it comes to asking for help, because we can't do it all. And, and again, realizing we're not perfect and we don't need to be, and that's okay. And then let's see, a third risk for burnout is, I think, trying to do it alone. I think that when we feel like, we have to hide our challenges, then it's very, very isolating. And when you have a group, when you have like people that you can confide in, and you have people that can help you see things objectively, it really, really helps prevent you from going down that path. And then lastly, I'll say, well, actually, I should have said this number one. Number one is lack of sleep. You will get burned out. You will want to quit medicine. You will think, I want to end my life sometimes, if you don't get sleep. If you want to quit everything and throw it all down the drain, then I beg you to go sleep, and don't set an alarm, just sleep. Your next day off, just sleep. And when you wake up, you'll see things very, very differently. A sleep deprived mind, and this is in my TED Talk, if you haven't listened to it, being awake for 24 hours is the equivalent of having a blood alcohol level of 0.10%, which would be above the legal limit to drive. So it is just, sleep is so important. I cannot stress that enough. So I'd say number one is sleep. Lack of sleep, number one risk for burnout, I think. So
that's awesome.
but all those, yeah.
I love those. I think it's so important that we know that, there are other people that are feeling what we feel. And if you don't reach out, you don't know. I'd like to add to that, obviously I have a different perspective than most people, because I speak with physicians who are looking for jobs, graduating residents, or even doctors who are now 1 or 2 or 3 years out of residency. And, so I'm kind of seeing everything from the spectrum. And a big risk that I see is physicians not taking burnout into account when they're looking for a job. And so, a lot of organizations burn their physicians out. They force them to see more patients than are safe. There's a lot of things. And then there's that feeling, like you say, of then the not reaching out and the not being vulnerable and not helping or not asking for help, which are so important. And then not feeling like you have a choice. You always have a choice.
Yes, you always have a choice.
Always have a choice. And I would say start preparing for, maybe you were wrong, and maybe you thought this job was going to be awesome and it's not. But you want to prepare for that before you even start looking. Like, you start your exit strategy the day you start looking for a job. That means not having a crazy non-compete, like being able to have some way out, being able to moonlight, all of those things. But you want to be
You said something that is so, so important, and I don't want it to get lost as we move forward. And you're talking about, oh gosh, I don't remember exactly how you said it, but the point is, like, you do such a beautiful thing. You are helping private practices find physicians who meet what they need while matching them with a physician and helping the physician find what they need. And so being afraid to ask for what you want because you're afraid to hear no, I think is a setup for burnout. And that is what you are preventing, Laura, by meeting with both sides and saying, look, I am not in the business of just matching people. I am in the business of matching people so I can have two happy doctors working together and loving their careers and loving what they do. And so often we are afraid to ask for what we want because what if they say no? What if they think I'm being too difficult? What if they think I'm, I just can't handle it? All these what ifs that we play in our mind. And I think that your service and what you do helps eliminate some of that because from the very beginning, you're asking both sides, what is it that you are looking for? What is it that you want? I'm here to help you find that. And that is just amazing. But there's one more thing that came to mind that I had to jot down because I didn't want to forget it. It's not in my talk because my talk had to be less than 18 minutes. But I went through burnout 3 times. And the first time I was seeing a crazy amount of patients, and what you look for, you will find. So when I would talk to people about it, they'd be like, oh yeah, that's crazy. That's absolutely absurd. And the people who told me the opposite, like, oh, you just need to consult more. And oh, you just don't, you can't be perfect all the time. I didn't want to hear that because misery loves company. And so I was looking for what I was looking for. Right. And then ultimately I was like, okay, I have to go. So then I went to my next job. And in my next job with the system I work for right now, it was amazing. Like this hospitalist job, I was like, this is too good to be true. But I trained there. So I knew it was going to be a good program. I would have never left if it weren't for the fact trying to be closer to family. But I remember going and hearing during our first huddle, that first week I was there, some physicians complaining. And I was like, they are so silly to complain about this. They have no idea how bad it is out there. Silly doctors complaining about this. And then fast forward 3 years later, I am crashing and burning hard, like hard. And so then I went to my next job. I transitioned out of clinical medicine. I swore I never was going to go back to clinical medicine, which I did enter last year, again, in a very small degree. I never thought I would. But when I went through burnout the third time, it was even a better job. I was on no call and no weekends, and I had all holidays off. And I didn't have patients yelling at me or, none of that. And I got burnt out again. And I take the time to tell this story because if we do not fix our bad habits and prioritize our essential needs, that's why we started off, Laura, thank you for this, saying me first, hashtag me first, because you can jump from one job to another like I did. And I promise you, the job can get easier and easier, and you still will get burnt out because those bad habits follow you. The self-neglect continues. You've done it for years. We all have in our medical training. So it is easy just to do it again and again and again. And so I challenge you to ask yourself, what is it that I am neglecting in my life right now that I know I need to change, whether that's sleeping, whether that's eating, whether that's exercise, whether that's time with family, whether that's connection with your spouse, whatever it is. There is something probably in everybody's life that we know we need to prioritize and we're not. So I challenge you to ask yourself what that is and just find one thing. And we constantly have to rebalance, right? I put my focus on my husband and my kids, and then I'm like, ooh, I haven't been exercising. Okay, I need to refocus over here. I do better here. And it's just constant adjustment. But all that to say, the burnout will follow you if you allow it. And I made that mistake 3 times. And I told my husband, like, this is the burnout line. Hey, look at that, Club Pilates. I go to Pilates now. That's my new favorite. That was not meant to be an ad. It was an accident. But this is my burnout line. And I find myself oscillating right under this. And so my goal is to oscillate a little bit lower so that I'm, well below that. But it takes constant work. It really does. So.
It is so hard. I could not agree more. I mean, going into my medical matchmaking, I was like, okay, I'm going to be my own boss. I'm going to be awesome. I'm going to have all this time with my kids. And I mean, I had figured out work-life balance with my doctor job, which I still do, but man, I took myself right along with me to my personal job. And I mean, holy moly, like I am the worst boss of myself because there's more. I can always do more. No, but I need to be doing more. No, but and in finding someone a job, it can take many months. So it's not like, what I enjoy about outpatient primary care is I can go in, see the patient, and leave and write the note. And that's pretty much, tied up in a nice little bow. But this is not. And I took all of my stuff. And so I oscillate here. And so I'm just working. And like you say, I know that when I exercise 3 times a week, I'm far better. But then that's, that cycle of, no, I'm stressed out. I need to do more. And then I need to do more. So I'm more stressed out. And of course, my brain doesn't function as well. So
Yep. I mean, that was, to me, like if I think about my entire TED Talk, like at the very end, to me, for myself, and what I was feeling was the most powerful. And that is when we say me first and we prioritize our essential needs, it's not selfish, because we really do become more energized and more productive and are capable of greater success with less time. And when we do that, we become the best version of ourselves. And we have so much more to give to everybody, to our friends, to our family, to our employer, to our patients, to the volunteer organizations that we want to go and give our time to. We have that when we take care of ourselves. And it is so hard to, and one of the things for charting, this is a big thing. A lot of people are spending hours at night charting. I'm like, when you're exhausted and you find yourself falling asleep and you're really struggling to write a note because it just can't come to you, you're exhausted. Go sleep. Do your notes in the morning. I am all for finishing it and getting it done, but you will finish it and get it done much faster if you are rested. And I wish I had learned that lesson in medical school. My roommate, I'm telling you, she was so good. She prioritized her sleep. I did not. I studied 10 times as much as she did, and my grades were very, very much lower than hers. So it's so important. It's so important.
yeah, no, I agree completely. And funny enough, I haven't been sleeping well because I'm taking care of a freezing house and all of those things this week. And my kids were like, Mom, you should get some coffee. Are you tired? And I was like, no, I'm fine without sleep. And they're like, oh gosh, this is like 1 hour before I'm about to get on with you. I'm like, oh, Liz is going to give me a spanking. So,
but here's the deal. Things come up. Life happens. And that's why we say it's not a one size fits all. It's not going to be the same for everybody. And it's not going to be the same for you all the time. You might have periods where you're not able to sleep. An ice storm comes, you're out of your house, you have no electricity, you're trying to reschedule things and things are chaotic and you're stressed and you're not sleeping. But as soon as you're able to, you prioritize yourself. And that's the key. And not beating yourself up because, oh, I should have slept more, or I should have done this, or I know better. Of course, we all know better, but we're human and we have real human emotions. So as soon as you're able to, you do it. And it's just giving yourself permission and not pushing through all the time.
Yeah. Well, I feel like you could give 50,000 TED Talks and break your TED Talk into 10 TED Talks because there's so much goodness in it. So if anyone wants to hear you speak or have you speak for their organization or anything like that, where would they find you?
So you can go to my website or you can find me on LinkedIn. It's lizaguirremd.com is the website, or at Liz Aguirre MD and LinkedIn. I am excited about doing more speaking. I will say, just like you, Laura, you know how you take on clients that you really feel like you can help and you can make a difference, and you have, what both parties are interested in heart. Like, you don't just take on anybody. I'm the same way. If I felt like, I was called to do a speaking event and it's not, I don't feel like it's aligned with what I speak about, then I'll be honest, because everybody wants a great speaker. And I realize that. But what does your teams need? What is it that they are challenged with? So when I speak to organizations, I do that intake. We talk about the challenges they're having, what their employees are experiencing. And for me, wellness in the workplace is so important. So I only speak for organizations who value that, because if the value is, workhorse, then it's just not aligned with me and my messaging. And so, yeah, but I do work with organizations and conferences. And so I would love to hear from anybody who's interested in having me speak. And yeah, I'm along for the journey and just taking it in stride.
Yeah. And anyone who has not gone to see Dr. Aguirre's TED Talk, go see it. It is called Professional Burnout.
In professional burnout, yeah, in professional burnout, and experience less stress and more energy, basically.
Awesome. Yeah, it was such a good one. I love it. I think, it's not even been out a week yet, and we have, last I checked, 20,000 views. So I think it's resonating with people.
Yeah.
But
That's,
I
I totally, like, I am floored by that, by the way. Like, I wasn't prepared for the number of people who were going to reach out and share their personal stories. So if that's you, thank you, because it really helped me feel like, I always say this, but I really felt it this time. I'm exactly where I should be, doing exactly what I should be doing. And I'm just thankful for all of you who shared your personal stories with me. And I hope you found strength and, say me first.
Yeah, totally. And again, say hashtag me first if you're looking for a speaker. Dr. Aguirre is the best.
Thank you.
So thank you for watching, and share this with anyone you think it can help.